Have you ever quietly wondered, can I actually make my penis bigger, safely? Why does my urine sometimes split like a broken hose? Why does my erection disappear the moment I start overthinking? If questions like these have crossed your mind, you're in very good company. Men ask me about these issues every single week. I'm Dr. Rachel Rubin, sexologist and urology specialist, and today I'm breaking down these concerns with real science, real clarity, and zero embarrassment. The internet is overflowing with myths and marketing gimmicks meant to make men feel insecure, so consider this your safe place for honest, medically grounded answers. If you're new here, make sure to subscribe and turn on notifications, because this channel is all about the conversations most doctors avoid. Before we dive into the details, drop a comment below and tell me where you're watching from. I love seeing this community grow across the world. Now here's what we're unpacking today. Why psychogenic erectile dysfunction, losing your erection due to anxiety or overthinking, is extremely common and absolutely fixable, whether the size you see in adult films is realistic or artificially enhanced, and why urine sometimes sprays or splits, plus how to know when it's harmless and when it needs attention. By the end, you'll have not only answers but a clear action plan for your confidence, sexual health, and peace of mind. Let's clear up 3 major myths right away. First, losing your erection during sex doesn't mean something is wrong with you. Most of the time, it's simply anxiety overriding your body's natural signals, and that can be reversed. Second, adult film performers are not the standard. What you see on screen is usually a combination of genetic outliers, camera angles, pumping tricks, and sometimes medical enhancement. It's performance, not reality. Third, a split or spraying urine stream isn't always a sign of serious trouble. Sometimes it's just dried semen, minor inflammation, or temporary narrowing of the opening. In other cases, it can point to issues with the prostate or urethra that deserve a checkup. Understanding these differences helps eliminate confusion and replaces fear with clarity. So let's tackle the first big question: why do some men lose their erection the moment they start overthinking? Erections rely on a smooth connection between the brain, hormones, nerves, and blood vessels. When you're calm and comfortably aroused, your brain sends signals that allow blood to flow easily into the penis. But when you're anxious, analyzing everything, or anticipating failure, your body switches into stress mode. Stress hormones constrict blood vessels and interrupt those signals. The first time this happens, it's alarming. After that, the fear of it happening again becomes the very thing that triggers it. This creates a cycle that can quietly erode confidence. The first step is always ruling out medical causes, especially since it can sometimes be an early sign of cardiovascular issues. If your doctor confirms there's no underlying condition, then the focus shifts to breaking the anxiety loop through therapy, shifting sexual focus to intimacy instead of performance, and sometimes using temporary medical support to rebuild confidence. Now, onto the size question: are adult film performers naturally that big? The reality is simple. The global average erect length is roughly 5.4 inches, and almost all men fall under 7.2 inches. Adult films showcase a tiny fraction of naturally larger men, and production teams use specific lighting, angles, and enhancement tools to exaggerate their appearance. Some performers also use injections, pumps, or fillers to maintain firmness and girth for long scenes. Comparing yourself to these men is like comparing a weekend jogger to a professional athlete on performance enhancers. It's not a fair comparison, and it's not reflective of real life. What actually matters in intimacy is connection, communication, and confidence, not measurement. Next, let's talk about urine streams that spray or split. Although it can feel embarrassing or unpredictable, there are understandable biological reasons. The urethra functions like a tube, and if anything alters its opening, such as dried semen after sex, mild inflammation, or pressure from an enlarged prostate, the stream can change direction or divide. If it happens only once in a while, especially after ejaculation, it's usually harmless. But if it's frequent, accompanied by a weak stream or difficulty starting and stopping, it might indicate BPH, an enlarged prostate, or a urethral stricture. Both are treatable, but they require a medical evaluation. Meanwhile, a simple practical adjustment like sitting down to urinate can help control the direction and reduce mess. So what can you take away from all this? If anxiety is causing erection issues, get checked medically and then work on rebuilding mental and emotional confidence. If you're comparing yourself to adult film actors, remember you're looking at a polished fantasy, not everyday reality. And if your urine stream occasionally splits, it's often nothing serious, but persistent symptoms should be discussed with a urologist. For men over 50, supporting prostate health can make a major difference, and supplements containing saw palmetto, pygeum, green tea, cat's claw, raspberry, and sour sop may help reduce inflammation and support better flow. Most importantly, none of these issues make you less of a man. They make you human. Bodies change, hormones fluctuate, stress interferes, and age introduces new challenges. What matters is paying attention, asking questions, and taking action. You're already ahead simply by seeking answers. Remember this: erections that falter under pressure can be fixed. Porn is not a guide for real life, and changes in your urine stream often have simple explanations. Knowledge is the key to restoring confidence, vitality, and control at any age. If this brought you clarity, hit subscribe, share it with someone who needs it, and let me know in the comments what healthy habit you're starting this week. Your health is your strength, treat it that way.